The Home Centered Care Institute is focused on expanding home-based primary care nationally to ensure that the most medically complex patients who are often homebound have access to medical care in the home. Home-based primary care, commonly known as modern-day house calls, brings doctors, nurse practitioners, physician assistants, along with portable technology such as x-rays, ultrasounds, EKGs, and lab tests right to the patient. This level of care has been shown to not only dramatically impact the quality of life of homebound patients and their caregivers, it's also been shown to reduce costs. I have patients that often say that they were always living in fear of getting sick because their only option was calling 911, ending up in the emergency department and oftentimes hospitalized. I've heard from caregivers and patients the peace of mind that it gives them knowing instead of having to call 911, they can call a caring, compassionate, home-based primary care provider that'll come right to their home.
HCCI's areas of focus are education, consulting, research, and advocacy. In 2017, HCCI introduced the country's first comprehensive curriculum in home-based primary care, developed in collaboration with the HCCI Centers of Excellence for Home-Based Primary Care. This work is also supported by the John A. Hartford Foundation. HCCI is committed to educating the future home-based primary care workforce, bringing more providers into the field, and setting clinical and operational standards that will enhance patient access and care. HCCI offers a variety of educational opportunities, including instructor-led workshops, hands-on training and procedures commonly done in the home, online courses covering a wide range of clinical and practice management topics, one-hour webinars and virtual workshops, and individualized practicum experiences offering providers and practice managers the chance to shadow trained preceptors in the field. In addition, HCCI also offers customized education designed to meet the unique needs of individual house call programs. HCCI provides expertise and guidance to new and expanding home-based care programs and offers customized solutions to optimize the efficiency and effectiveness of practices. These offerings include practice assessments, chart audits on coding and documentation, and on-site coaching on coding, billing, and documentation. HCCI is an authoritative source for new information, data, and insights to establish and validate clinical and operational best practices, quality benchmarks, and ultimately treatment guidelines that further validate the home-based primary care model, demonstrate its value to payers, and improve the long-term sustainability of home-based primary care programs. HCCI is helping to move home-centered care into the healthcare mainstream by supporting payment reform and increasing awareness among the public, providers, and payers and policymakers of how traditional house calls have evolved into technologically advanced home-based care. The organization is doing this in a number of ways, including working with organizations like the John A. Hartford Foundation, the American Academy of Home Care Medicine, and other important associations and advocacy groups. They are also conducting an ongoing communications campaign to educate audiences about this model of care, and working with other organizations to support key initiatives like the Independence at Home demonstration project started by the Center for Medicare and Medicaid Innovation. Overall, the Home-Centered Care Institute exists for one primary reason: to help ensure that those patients who need house calls get them. Because the future of healthcare is in the home.